Welcome, Hussein. Welcome, Patrick. It's really great to have you both here today. Two of the great industry leaders in healthcare, two of the most renowned CISOs within healthcare. I'll pass to Hussein for a quick introduction.
Good day. My name is Hussein Syed. I'm the CISO for Robert Wood Johnson Healthcare System based out in New Jersey. We are one of the largest provider in the state of New Jersey for healthcare services.
Hey, everybody. Patrick Phalan, Chief Information Security Officer at University of California, San Francisco, one of the leading academic medical centers in the nation.
Thank you, and thanks so much for joining. I had a question that I was going to dive into before we actually started recording, but I'd love to ask you for the purpose of our audience. It seems as though obviously AI is at RSA conference, right, 2 weeks ago. Everything was agentic. The year before was AI for security or security for AI. And obviously the technology is shifting. My question for you is, do you think that this time is actually multitudes or higher than previous technology revolutions, such as cloud computing or mobile, or even just the advent of the computer or the internet more generally? Do you think that this time, do you buy into the hype, or do you think it's just another evolution? Do you think it's an exponential evolution of where the technology is going, or do you think it's more linear?
I've been going to RSA for 15 years, and every year there is a theme that this is going to change everything. That's what it felt like last year with AI, and you're right. This year, agentic AI was all over the place. I do kind of have high hopes for agentic AI. I think this is where we actually start to see some benefit from AI. I was reading an article recently, and they were flashing back to a couple years ago when I think Gardner told us everyone was going to be a prompt engineer. So everyone was going to lose their job, and all we were going to have were prompt engineers. And I don't think I've met anyone with the title prompt engineer. But yeah, I have higher hopes for agentic AI.
For that piece, is that just to remove, is the agentic, tell us more, is it replacing mistakes that humans might make, like a car, right? An autonomous vehicle maybe can cut down 99% of traffic. Is that kind of where you see the value here?
I see the value in overcoming bureaucracy. So I think there are a lot of tools where AI can do neat stuff, but you get into healthcare, you get into a highly regulated industry, you get into organizations like ours, and I'm sure I'm not alone here, but we have hundreds of legacy applications, and it's putting things together for a new AI product. It's not easy. So a lot of the work goes into implementation. I'm hoping that agentic AI will do some of that work for us and help organizations see a return more quickly.
Awesome. And Hussein?
AI has been around for decades, right? It's not a new concept. It's maturing. It's getting where it needs to get to, the language models, the decision making. It's still in that stage where it's augmenting decision making. It's not really making decisions in many areas, right? And agentic will actually help clean up some of that challenges in terms of how the interaction takes place. But the bigger challenge I see still is the quality of data and how the bias is managed within the data sets, so that when people are really interacting with AI, whether through prompt or computer vision, they're not getting swayed by a bias. And bias could be in multiple forms, right? Could it be a bias that needs to be introduced to address some of the problems that are there with the data in terms of, changing times and political correctness or whatever it's required to be. But I think in the next 2 or 3 years, we'll see there's going to be a shift in skill sets. There may not be obsoleteness of skilled workers, but there will be upskilling of people in many areas that AI is going to bring along.
Yeah, I love that. And let me dive into the introduction for this webinar specifically. So this webinar, the title for this is Securing Healthcare, Adaptive Security for Patient Data, medical devices, and operational resilience. And so we'll dive into all things AI in a moment, but I think just to set the context for some of our viewers, healthcare industry is at this kind of critical inflection point. I feel like it's similar for a lot of different CISOs in different industries, but healthcare is definitely one that's of major interest. It's in the news, right? There's ransomware attacks that have crippled hospital operations, medical devices that maybe are unpatched or maybe not dealt with in the right way can contain hidden vulnerabilities. Insider threats are obviously a kind of persistent risk that very interesting within this space. I think the confluence of that with healthcare is expanding digitally, right? You have electronic health records as well as telemedicine. I think during COVID, of course, that kind of hit a really interesting growth time. And then the Internet of Medical Things. The attack surfaces are changing and increasing, which we think making adaptive security is very important for healthcare. So the goal of this discussion, we're going to talk about the biggest security challenges in healthcare today, and then we're going to talk about how new forms of cybersecurity can dynamically protect patient data, medical devices, and critical infrastructure, and make sure that resilience is strong. And then for some of our viewers who are, maybe they're CISOs at smaller hospital networks, we can discuss really tactical, real world strategies for moving beyond compliance-driven security. So I'm gonna direct the first question here to Hussein. So Hussein, hospitals and medical centers remain high-value targets for cyber criminals who can be anywhere in the world. As the CISO of RWJBarnabas, which is one of the largest hospital networks on the East Coast, what are some of the biggest security threats that healthcare organizations like RWJBarnabas face today?
It's a funny question in the context that all health systems, all large enterprises are probably at an equal threat level from any adversaries. Unfortunately, healthcare is somewhat being targeted more so than other industries. If you look at the Consumer Report or FBI reports, you see a huge difference in how healthcare organizations are attacked versus the number of non-healthcare entities are attacked. Surprisingly, manufacturing was number 2 or number 3 in the last FBI report about targeted organizations. I think the primary reason is the value of patient data and the need for healthcare availability makes it a target where adversaries feel that they can create a bigger chaos and a reputational challenge for organizations. And as you mentioned earlier, the digital transformation that healthcare has taken in the last 10, 15 years has literally transformed the way healthcare delivery is done, at least in the US hospitals, right? A lot more reliance on technology, a lot more reliance on data and decision making, a lot more reliance on availability of systems and access to information at the fingertips. And so for an example, clinicians rely on radiology and lab work immensely to make decisions and quick decisions. And if any of that value chain is disrupted, it's an impact to the time to service to the patient. And that's why it's the technology is critical to the healthcare environment. And that brings a risk of cyber.
I myself, I'm totally fine and very healthy, but I did have a minor scare just 2 weeks ago. I had my liver enzyme in my blood test, my annual physical was off, right? And so I had to get more blood tests, and it kind of remained the same. And I went to I had a ultrasound done, and then it was a very seamless process with Cornell Weill is the hospital network I use here, but in New York City. But yeah, it was a very seamless process to access the app, and the radiologist was able to get the information to the physicians very quickly. And it turned out, to just be maybe I was dehydrated or something, right? Not a big deal, just no issue. But yeah, I can imagine, right? And if in a more serious instance, imagine if there was something really wrong and the attackers are holding, that system hostage, right? And the impact that could have on the lives and the emotions of patients.
Yeah, and it's a funny thing. So, almost everyone has a mobile app on their phone that they can access their medical information, and they can sometimes access natively written application that it's only understandable by clinicians. So there are apps out there that will actually translate that information into human readable format where, dislocated shoulder versus, minor infraction with your healthcare record, right? So there's the information availability and expectation of that is growing with the patients now that they need to be able to access their information quickly.
And just to double click, I mean, and I'll pass the to Patrick in one moment, but what is the worst attack you've seen? Was it that Lurie, Children's Hospital in Chicago with I think it was a ransomware breach? What have you what is the worst case scenario for a healthcare CISO?
And the worst case scenario really is if there is an intruder for a number of days that can potentially cripple the systems. So to find that zero patient or zero target or zero device that could have been infected, and to go back to that and be able to eradicate the threat and bring the operations back to near normal is it could be a challenge. There have been large attacks. I think the last report we read was, and Patrick, you could correct me, it's at least 24 to 30 days of unavailability of systems in a healthcare environment if an attack takes place.
Mm.
So that's the challenging aspect of, dealing with the recovery, business continuity, and then dealing with the rest of the regulatory issues that may arise from that.
And your role is just incredibly important to ensuring, emotional and physical health of the country. So I'm sure you feel fulfilled, right, in your day to day. I'll pass to Patrick here. So Patrick, obviously you're the Chief Information Security Officer, a leading university, right? So in the UC system, UCSF. UCSF, I believe, is exclusively focused on health, right? Now, so you kind of have these dual mandates, right? You're the CISO of a leading university system, right, as well as the CISO of a leading healthcare system. And these are different domains, and maybe there are similar challenges in both of them. But how do you balance this, right? I think one example is students need access to data to learn, right? Medical students, perhaps, and how do you kind of balance security, resilience, and access for medical staff and medical students alike?
It's a constant struggle. So, of course, on the health side, the organization is very top down, and it's a more straightforward process to implement security and to get people to do things in general. You convince leadership, and then everyone falls in line. Higher ed is something else entirely. You have faculty who are who they are because they're creative thinkers who don't want to be constrained by me forcing them to install an agent or to use some limited set of software and to not use open source software. So on one end, I have this highly regulated environment. On the other, I have people who are telling me, and there's a bit of an exaggeration, but I do hear it. They don't want any security. They say, we're doing research because we want to share our findings and our data, and we want 100% open collaboration. And it's hard to resolve those things when you work in security. Not to mention on the higher ed side, you have we're definitely a target for nation state attacks, particularly China. They're interested in our research, as they are in many industries, and shortcut to getting ahead in R&D is to steal research. So we need to remind our higher ed faculty and researchers that their IP is valuable, can be extremely valuable, and while being open and sharing and participating in the research enterprise across the nation and world is important. You don't want people stealing your IP.
I just asked Perplexity, and I thought it was 60 billion, but it's a lot higher. I asked Perplexity, what dollar amount of IP does China steal per year? And the estimates for the dollar amount of IP stolen by China vary widely, but the most commonly cited range is between 225 billion and $600 billion per year. Right. So when you think about within healthcare, right, large revenue sources, government grants, right? If the institutions aren't defending this amazing research and development properly, then perhaps maybe the government would give funding to organizations, institutions, healthcare institutions that are better able. Nothing's ever perfect, but better able to defend against this type of R&D and IP theft.
And this became real to me. This is kind of a personal story.
Yeah, please.
One of my brothers was in the FBI, and a case that he worked for many years was some Chinese nationals stealing formula for titanium dioxide. It's this chemical that makes the color white, and it's owned by Dow Chemicals. You should Google the story later. It's a pretty fascinating story, but it's IP that China was stealing from an American company that was worth billions of dollars.
Amazing.
It all sounded very far-fetched, like a movie, but it was very real.
There's a lot of compliance-driven regulations. There's a lot of just regulations generally within industries like healthcare. Healthcare might be the most regulated, right? Healthcare and financial services are arguably the two most regulated industries, and maybe healthcare is number one. So, how do you balance that need for compliance, Patrick, versus actionable security? And I think you were getting to this a bit before with the agentic piece, but how do you balance those two elements?
Yeah, and I keyed in when you said compliance earlier, compliance versus security. And I think in my own tenure in this job in the early days, 10, 15 years ago, I was focused on compliance. And that was really before we saw ransomware bringing clinical operations to its knees. So I was more concerned with HIPAA compliance and checklists and checking boxes. And over the years, obviously, it became more serious as you also mentioned, digital transformation and the fact that this generation of clinicians have grown up using technology. So the electronic health record hasn't been around all that long. I mean, 20 years ago, the generation of clinicians, they started with paper. So they were more well equipped to function if there was a major disruption with systems. That's not the case now. Now it's integral to operations. I would say, of course, I'm always thinking about compliance. It's there for a reason. I'm glad it's there. I think it's helped driven security in the right direction in healthcare. Is security in healthcare where it needs to be? No, not at all, as evidenced by the fact that it's one of the most targeted industries. But yeah, these days I think more about security risk and interruption to operations above compliance. And we should mention that there is a proposed change to the HIPAA security rule. Unclear whether or not it will pass during this administration, but it's a pretty significant change that is going to require organizations to invest quite a bit, I hope.
Give us the just for some of our listeners, the 10-second or the 20-second overview of that change that's proposed.
The HIPAA security rule as it is, a lot of it is pretty mushy, and you have addressable requirements, meaning some of the things you don't have to do them as written. Like HIPAA security talks about encryption. Well, you can address the encryption requirement in other ways. Like you can say, well, my servers are behind spiky bushes and brick walls and locked cabinets, so I don't need to encrypt them because they're physically protected, and that's the threat vector for unencrypted hard drives, stuff like that. So it gets more specific, and it doubles down on risk management. HIPAA is very heavy on risk management, but they're a little vague about what you need to do, and the proposed new rules would say an organization has to do an enterprise risk assessment annually. That's a change.
And let's go to Hussein here. So I think our viewers and listeners have a good understanding of the incredible amount of responsibility that the two of you have, and people in your role as well at CISOs at major institutions. With the changes in technology, the changes in, administrations, regulations, and I think, we spoke a bit earlier about how fast AI is moving, and if this can really be a much bigger change compared to the past than, for example, the mobile revolution or the cloud computing revolution, right? If this one is more linear or exponential in its changes. But as my question for Hussein is, as the technologies and as the macro environments change and the technologies change, how do you think about adapting a security, right? How do you build a dynamic, adaptable security organization and security stack without getting in the way of those more kind of, stringent compliance requirements?
The best security is invisible security, right? It's not inconveniencing the user, but it's in the background doing what it needs to do. In order to, do that, it's a long game. Security is not a short term, it's not a project, it's a program. It is a journey. You have to start, understand the environment, understand the business, how it's conducted. Every hospital has their own way of conducting patient care delivery. No two hospitals operate the same way. So you have to understand how your environment works, the technology that's used, the workflows that need to be built. And then you have to plan your security, whichever framework you use, whether cybersecurity framework or any other frameworks you pick to use, you have to start implementing it slowly, gradually to bring that change into the environment and sustain those changes. So the change management is critical to how security is built and rolled out so that you only implement sustainable changes that are adaptable, that are understood and accepted by the leaders and the users. And you're able to enforce the change slowly and one important aspect of that is to educating and keeping the user community in sight so that they actually understand why certain changes are being made. And that in itself brings compliance. So if you look at HIPAA regulations, just like Patrick said, the encryption requirement, and if you have to look at, data security, encrypting and access control are two things, right? So if you implement proper access control and proper encryption, you inherently achieved HIPAA compliance in that required control, right? So that's the challenge. Challenging part is the dynamic nature of our environment. There are cyclical changes that happen during cold season. There's a lot more patients getting sick with flu. There's people coming into the ER, they're sick, they're impatient. So our security can't get in the way of patients being treated. So the environment has to be built to sustain that. The resiliency has to be there to ensure that when patients come in, the systems are available, the users are able to log into the systems. So we have a number of technologies like single sign-on, access control, other things to make it very expeditious for clinicians to get into the systems quickly.
When there are changes, let's say, IT help desk, right? Or, the call center, like when there are changes with the APT groups, the advanced persistent threat groups, and the tactics, the sophistication is changing of attack. And users, in your case, doctors, clinicians, researchers, medical students, administrators, et cetera, they need to understand how things are changing. They need to be security aware, right?
Yeah.
Because there is no silver bullet within the systems. That's the fact of the matter. The 80 to 90% of breaches are still starting, within the human layer. Depends on which stat you look at. But how do you ensure that users are security aware without getting in the way of them treating patients?
It's a very difficult thing to do, actually, because a clinician's role is primary responsibility is to care for the patient, to treat the patient. Our job is to help them, treat the patient safely, securely. Patient safety comes first, right? That's any health system you walk into, that's what they'll tell you. Patient safety is the number one concern. everything comes up secondarily. So now what our job here is to kind of educate and inform the clinicians that cybersecurity is actually patient safety. So secure systems, not properly securing systems can ultimately result in patient safety issues when systems go down, when medical devices are unavailable and things break because there's a cyber incident. It really is a patient safety issue. So continuous, awareness is the key in whatever shape or form it's done, but it has to be very succinct and very quick to make sure that the the workforce understands that cyber is an emerging risk and it's a moving target. A threat that was not even considered a risk a month ago or a day ago might be a critical risk today because the way the threat actors have figured out a way to circumvent controls. So it's a tough thing to, you have two lanes running, right? One, adversaries looking to capitalize on any vulnerability, any weakness they could possibly think of. And our job is to kind of try to protect ourselves from them, realizing that risk.
Hussein, I think. Oh yeah, go ahead, Patrick. Please jump in.
Jumping out of my seat to tag on to what Hussein.
No, please do. I was going to ask you too. Yeah.
5 years ago, we're all excited. MFA. All right, we've got MFA now. We've solved stolen credentials, and here we are. And the bane of my existence may or may not be this week duo or MFA fatigue and MFA harassment. People getting just hit with a barrage of MFA prompts, and time again they just accept them. And it's because people are busy. There's so much to remember. These are smart people. These are doctors, and this control that we thought was a panacea. The threats have changed. The threat actors have learned how to get around it a lot of the time. So we need to keep adapting our approach. We need our user base to understand this relatively new threat or continuing threat, and you need to get them that message. And annual monolithic cyber security training does not help with this sort of thing.
We have a little saying, Dune security. We say security awareness training is dead, which has a lot of meanings, but typically what we mean by that is the monolithic, like I like the way you phrase that, the standardized one size fits all training. Something that it just doesn't work. It's ineffective, it's inefficient. And what just really struck me is what you just said, MFA fatigue. I've never even, it makes perfect sense, right? People feel harassed by it, right? Or it makes perfect sense, but I've never even heard that. So some CISOs and security leaders generally are anti anything related to the user, security awareness. It'll never work. We just need to build the castle walls better. I'd say roughly about, talking to probably thousands of CISOs at this point, probably about like 3 to 5% of CISOs that just would never want to invest in something. But 95 to 97% are thinking very differently. Patrick, how are you? And obviously the UC system it's massive, right? And you are one of the leading CISOs in the country generally, but you're also, one of several CISOs at university at UC, University of California systems and institutions. So California would be like the fourth biggest country we all know if it was its own country. So the scale is big and the complexity and the procurement cycles are long. But how are you thinking about adapting that, user security posture, right? And Dune security aside, how would you, in a perfect world, how would you like to help prevent phishing, social engineering, insider threat, right?
I wish I knew the answer to this. I know that sitting in front of slides for an hour is not the answer. And I talked about duo fatigue. Then just another real world example that I saw recently. The threat actor used a technique called click fix. So they compromise a legitimate website and they add a legitimate looking CAPTCHA, and the user, it tells the user, hey, I need to verify your identity, shows a real CAPTCHA, select the fire hydrants, buses, bicycles, whatever. And at the end of the CAPTCHA, it copies malicious code to the user's clipboard, tells the user, open command prompt, a PowerShell window, and paste this script in there. So the users have no idea. They think they're just complying with the CAPTCHA, and they're actually copying and pasting malicious script that installs a remote access Trojan on their computer. So that is not something you can teach someone in a year-long training. That is something that I wasn't familiar with. I guess it became popular at the end of 2024, but I had not read about it, seen it until we saw it used against us. So the every year there's going to be new things like that. And how can you deliver the right training to the right people at the right time? And how can you deliver it in a way that is small enough that they can consume it and remember it? So I think Dune's approach is the way of the future for sure.
Yeah, I think one thing we think about is not just increasing, the effectiveness of training with hyper-targeted training or AI-driven phishing that's just going to users based on their role and their risk profile and the company. What we do is we mimic workflows, right? So we're able to completely mimic the workflow of a user in their day-to-day interaction, and then thereby automatically and scalably for hundreds of thousands of users, we're able to deliver the highest levels of sophistication social engineering possible. But I think there's a core benefit. Something that's really interesting to me about this conversation is the emotional element, right? And I think something that we do is we reward low risk users. We define risk based on the business impact of the role, the simulated attack data, training data, as well as the risk signals that are coming from the rest of the stack. So right now there's 4, maybe next year there'll be 10. We'll see how the product evolves. But the users that are low risk based on the comprehensive set of data and risk signals, we are able to reward those users by reducing the amount of time that they have to spend in training. Very simple, right? And one key component that I think we've done well is reduce that adversarial relationship that often arises between the CISO and security teams and the end user, which can actually be counterproductive to increasing security awareness at a high level. So, in this question, I think let's go to Hussein here. So question for you around, there's with AI, there's an increase in both the quantity and the quality of social engineering, right? When we think about the quality, Patrick laid out a very sophisticated attack, but what about just general modalities, right? Things like phishing, deep fakes, right? AI-driven phishing that's taking in user data to deliver it specifically to users. Hussein, what are you seeing in the wild? Is this hype? What's going on? I think one example we saw yesterday with Coinbase, they had a pretty big breach, which was using some of this more sophisticated type of social engineering. But what have you seen, Hussein? What's keeping you up at night in terms of the quality of social engineering?
AI, has definitely accentuated the quality and the volume of attacks, right? And as you mentioned, the deep fakes, the phishing, the other things that are becoming very close to real and difficult for somebody to identify if it's really a real need or an email, or is it a fake email, or is it a phishing email, or a phone call, or a text message, right? It's happening in two, the quality and the volume. So where they intersect is where the challenge is, right? The amount of quality attacks coming and the volume of them coming, at some point, the users, which is the weakest link here, could potentially fall for it, right? That's really the end game, is for somebody to click on something or accept a inbound remote access request or something, right? So that's where the challenge is. So now we have to separate education versus awareness. A lot of times our organizations focus on education, which we have all talked about, right? Once a year type of thing. But awareness is what you need to take the real life incidents and data and now build some sort of awareness around that real life incidents that have been picked up to develop awareness for the users to be able to point out or detect any type of attack that's directed towards them. And that's the challenging part, where how to find the right amount of awareness to be driven towards the user. And as you mentioned, if you risk stratify the user community, then you can focus on the high risk users more than the low risk users. Could be by the job family and other things as well, right? That were people in high profile jobs or high sensitive jobs may need to be provided more awareness than people who are not. So it's really a challenging thing. AI is going to change the game for adversaries, just like it's changing the game for, real business needs.
Patrick, what about you? Anything to add there?
Hussein was making me think about the makeup of my organization. And so a university is like a city. We have a police department, we have a couple taquerias, we have stores, we have doctors, nurses, just any job role you can have, we have. And the threat model for different types of employees is totally different. We see gift card scams all the time in the C-suite. Hey, this is the CEO. I need $1,000 in Google Play gift cards immediately. That just happens over and over again in the C-suite, with the executive assistants and everything. But cafeteria workers are not being hit with that scam. So there's an example where the training needs to be more targeted and match the threat model.
So we have in our product, in our platform, we really think of it as we're building 3 core products. There's user adaptive testing, user adaptive training, and then there's user adaptive security. I think you're one of the best CISOs to answer this because you've, like we talked about, 2 very kind of different but complex institutions to be a CISO, the healthcare and educational major institutions. So have you ever considered, and obviously different users have different access, right, and restrictions based on their role. And a lot of that is perhaps driven through identity platforms or driven through manual efforts and your team's great work. But have you ever thought about, changing access and permissions, perhaps dealing with increasing friction for users based on their actual risk, right? Not just based, which isn't limited to their role. It's also limited to it's also dependent upon their behavior. It's dependent upon how they interact with advanced simulations. I mean, that's what we enable. Have you ever considered this approach? Is that something that's possible?
That'll always be the dream. And it makes so much sense because it's really frustrating when you have an incident and you look at patient 0 and you find out that they had more access than they need. Or another thing that happens in a big organization is people move around and you have rights creep. So if you work at this organization for 20 years, maybe you've had 5 different jobs and you probably don't need the same applications and data that you used in your first job with your current job. Yeah, so having the ability to do what you're describing would be probably a game changer.
Yeah, that's why we think we have a chance. That right there, that's why we think we have a chance to build a huge company. I've talked to some of these whatever top 10 VCs around you, and they say, yeah, you could build a company, with 20 million ARR that takes a lot of Novi for security awareness training, and that's great. But how do you get it to hundreds of million? That's I think we're that adapting of user adaptive security. That's kind of the vision. Love that. We're almost at time here. I'm going to just review. Is there any topics that the 2 of you want to discuss before I just kind of ask another random question? Anything else top of mind?
Security is a building block, right? It's not a short game, as I said earlier. You really need to think, and human is at the center of it. And so what do, you have to consider the human to be trained and educated.
Yeah, it's for what really struck me is there was amazing companies like CrowdStrike and Okta, right, and different layers of cybersecurity. And you look at email security or clouds, and Wiz is one of a phenomenal story with Wiz, obviously. But there was no good, big, enduring company in this space. There was an enduring company that has a big market share, but it seemed like the technology wasn't really useful for complex institutions and organizations. So yeah, the human layer is important. You know what? I think I'm gonna wrap this up here. So this was an amazing conversation. Hussein, Patrick, thank you for your time. I think for the viewers that are watching this, and hopefully a lot of healthcare CISOs are tuning in and watching these clips here. Some really amazing strategies and thoughts here. We talked about how static security models are potentially failing healthcare, right? As the attack surface is expanding and as the attacks themselves are changing in terms of their quantity and their quality and their sophistication with new technologies like AI, right? The advent of Gen AI and other tools. We talked about how legacy approaches to security awareness, access controls, friction versus security, compliance versus security might not be as efficient. We talked a bit about how building a dynamic security posture that's able to continue to improve and, for example, role-based protections, behavior-driven access management, increasing automation through tools like AI without increasing risk. We think that creating user-adaptive testing, user-adaptive training, and user-adaptive security is the future for healthcare. And it was great to speak with you today to discuss some of these important topics.
All right. Great to talk to you, David.
Same here,
Thanks,
David.
Patrick.
Thank you. Yep.
Thank you
very
so much.